What did you see this time around that made you believe that these are white phosphorus wounds?
The injuries from white phosphorus or the burns from white phosphorus are very characteristic. White phosphorus is a chemical, and so unlike thermal burns, i.e. heat burns, where the burn is on the outside and then moves in, these phosphorus burns really just drill their way through the body until they reach the very deep part of the body, because as a chemical it continues to burn until it's no longer exposed to oxygen. And so these burns are almost like a core that goes from the outside to the inner aspect of the patient. And you've seen it once, you've seen it again, because when you start cutting away at the burn tissues, really it's like a tube of burn tissue going all the way inside.
So basically, as soon as you see it, you're able to...
If you've seen it once, you see it, you know exactly what you're dealing with.
Right. And what kind of effect does it have on the injured?
So the depth of the burn means that the disability that they cause because of the amount of fibrosis and the limitation in movement is much, much worse.
Right. And when patients came in with these wounds, were they conscious? Were they unconscious? I mean...
So because they'd been used before, patients actually knew what they were.
They were saying it.
Absolutely. And so what was happening is that these bombs would explode at high altitude, and then they would cover the whole area with a kind of canopy of these phosphorus pellets, which would rain down on patients. And if you'd see, even the wounded, they'd seen them before in 2009 and they knew what they were.